minute or and we'll wait another minute or two and let others join. So we'll get started shortly. Today, my name is Courtney Carta from the Maryland Healthcare Commission. I'm also joined by my colleagues today, Teresa Lee and Sumitria McCammon. So today, of course, we're going to be talking about the new HCAHPS data submission requirements for MHCC. But before we get started, I just want to remind you to please keep yourself on mute. We will have plenty of time at the end for questions where you can unmute yourself if you'd like to speak. You can also feel free to use the chat box during the presentation. So we are recording this webinar. So after the event, I can send out a link along with these slides. So you can feel free to share these with others in your facility who might be interested or who were not able to attend today. We'll also post this information on the Maryland Quality Reporting website. So once that's up and posted, I can send a link once it's ready. Okay, so as you may recall, I sent out an email back in July announcing that MHCC would begin collecting detailed HCAHPS data. So since then, we've been working behind the scenes to get our processes set up. So today we're going to be talking a little bit about what we're doing and why we're doing it. And I'll also go over the specific timelines, and I'll give you some specifications, and we'll go through the account setup process. And at the end here, I'll actually give you a demonstration on the website to show you how it looks once you're logged in, and I'll show you how to actually submit data as well. And just so for a little bit of background, we know that patient satisfaction is an important quality indicator. But unfortunately, Maryland has had historically lower HCAHPS scores in the nation for quite some time. So I pulled together the publicly reported data from Hospital Compare for the past 5 years, just to give you a visual idea and show you how Maryland has performed as a state compared to the nation. So these are the two overall measures. Patient rated the facility a 9 or a 10, and the patient would recommend a hospital. So Maryland is shown here in yellow, and the nation is shown in red. And as you can see for both of these measures, we're about 6 to 7 points lower than the nation. And we haven't really improved. We're just sort of stagnant, staying steady. So I created 8 other graphs, and I won't go through them individually because the trend is sort of the same. I pulled together the communication measures, as well as some environmental measures. There's just one exception. Patients do feel like they get appropriate discharge information. Maryland scores pretty well. We're pretty on par with the nation, and that scores high. But most of the other measures, we have not seen a lot of progress or improvement. So if you're not familiar, MHCC is the state agency responsible for public reporting. So we report on quality measures, patient satisfaction measures, infection measures, and not just for hospitals. We actually have a lot of different healthcare settings that we have different types of data for, like nursing homes, assisted livings, health plans. So if you're not familiar, all of this information is found on the Maryland Quality Reporting website. This is a consumer-facing website. And this is linked, so when I send out these slides, you'll be able to click on here to get to the site. But it's got a lot of wealth of information. So this is where we actually house the current HCAHPS data that we display. So we download that data quarterly from CMS Care Compare, and then we update it on the state website on a quarterly basis to align with those CMS updates. But unfortunately, the data that is available from CMS is limited. It's pretty general. It doesn't include a lot of detailed information such as race, ethnicity, or information about service lines. So it's really hard to determine where those potential problem areas may lie without enough context and more information. So starting in 2022, MHCC will require acute care hospitals in Maryland to submit detailed level HCAHPS data. So we plan to use this data in a number of different ways. Health disparities, or addressing health disparities, is really a huge priority, not just within MHCC, but across the state too. So we plan to use the detailed HCAHPS data to explore potential disparities across specific patient populations or among the various HCAHPS domains. We really think this will highlight areas where Maryland hospitals may need to target their improvement efforts for vulnerable populations. So on that consumer site that I mentioned, we have a new health disparities initiative. So we plan to use that portion of the website to be able to share and communicate our findings. We really see this as a collaborative effort. We know hospitals and a number of various organizations across the state are really invested in helping and seeing these patient satisfaction results improve. So the Health Services Cost Review Commission, or HCAHPS, is our sister agency. And they're also interested in exploring the potential use of the detailed HCAHPS data for the quality-based reimbursement program. So they've indicated that they're very excited to work with MHCC and with Maryland hospitals. And I think both agencies, we really have a shared belief that this effort to collect the detailed HCAHPS data will help empower hospitals to be able to share best practices and lessons learned and improve patient experience in the coming years. So I know maybe some ears perked up when I said HCAHPS. So this is very early on. So I did include their email address here on the slide if you have any questions or comments or feedback. I do think we have some representatives from HCAHPS on the line today as well. But this is an email box. They're very responsive. Your email will not go into the abyss. They're always communicative and available for questions or comments or concerns. So in terms of our timelines, our deadlines align closely with CMS to minimize any extra burden or confusion. I know you all have a lot of data and you do a lot of submitting and it can be confusing. So we do try to align with CMS. So it's one less thing you really have to think about. So our data, we will collect it quarterly, just as you submit to CMS. And we will start with Q3 2021 discharges. So that is coming up. The due date to CMS is January 5th. So generally when we collect data separately, MHCC collects data separately, we give a 1-week grace period. So our due dates for MHCC will always be 1 week after the CMS deadline. So that means the MHCC deadline is January 12th, 2022 for Q3 2021 discharges. So we've still got 2 months, but this is the busiest time of year. So I know with the holidays coming up, it will come up very quickly. So typically what I will do, what I've done for other data collection efforts is I'll send out a reminder email a week ahead of time. And then I will send follow-up emails either the day before or on the due date, just to remind you for those people who I haven't gotten submissions from. And then after that, I will start tracking down missing or late submissions. So if you would like to avoid getting a lot of emails from me, best rule of thumb is to make sure you submit on time. So with that being said, we know in the beginning it's going to be a new process and we'll probably still need to work out some kinks. We're very flexible. We know things come up, and if there's ever an instance where you think you'll be late or maybe there's IT problems, all we ask is that you let us know so that we can make accommodations. Okay, so and this is just a calendar of those deadlines. Here we have the CMS deadline, and MHCC will always be 1 week after. These dates have not yet been announced for Q1 and 2 of 2022 discharges, but once these dates are announced, I'll update this table and we'll get this information out to you. Okay, so what exactly are we looking for? MHCC is asking for the exact files that are submitted to CMS. We don't want you to do any analysis or data manipulation. We just want those XML files that you send to CMS. So we would prefer to have one XML file for each quarter. So 3 months of that quarter in one file. I included a naming convention, a file naming convention example here. This isn't mandatory, but it's really helpful on our end as we do some tracking. So if you can try to name your files with the year, the quarter, your facility name, and initials are fine, and then the discharge months. So I know that the discharge months and the year and the quarter, it's a little bit redundant, but it also serves as an extra check to make sure that you're submitting the correct file to us. Okay, so in order to be able to actually submit to us, we need to set up an account. So this is a very secure website. It's not like a retail website where you can just go sign up and create your own account. MHCC does need to initiate that process. And again, after I go through these slides, I'll pull up the website and I'll give you a brief demonstration on how to do that. But I'll just walk through the process beforehand so you have an idea of what to expect. So step one, each hospital must identify a primary point of contact to set up an account with us. So we'll set up what we call a hospital administrator account. This doesn't necessarily mean you are the person who will submit, but this means you're the primary point person if I have any questions or if I need to send reminder emails or get in touch with your facility for any reason about the HCAHPS data. So step two, once you've identified that person, please email me. Here's my email address. And all I need is your name, your facility, your email address, and your phone number. And then I can create your account. So I put on here a deadline of December 3rd. So that gives you about 3 weeks. If you need extra time, please let me know. But the sooner the better. So I plan to spend probably after December 3rd, if I haven't heard from your hospital, I'll need to spend some time following up with hospitals. So you don't have to wait that long. You can do it ahead of time, and that would be great. So step three, once you send me this information, I will create your account, and then I will reply to you with a username. You'll also receive a separate confirmation link. This will let you activate your account, and you can set up your password and create your security questions. So caveat with that, I just want to let you know that that separate activation email will come from qmdc.noreply@advantagovernmentservices.com. So it's a long email address. Some hospital spam filters don't always like it. So if you are expecting this confirmation email and you don't get it, make sure to check your spam or your junk folders. I would also recommend just putting this email address in your address book, because if you ever have to reset your password, the email will come from this address as well. So it probably isn't the first time you'll see this email address. And when you get that activation link, it is good for 2 hours. So if you're not at your desk or you can't set up your account within those 2 hours, not a big deal. All you need to do is just send me a quick email. I'm happy to reset the link for you and send it whenever it's convenient when you'll be at your desk and able to set up your account. Okay, so the last step, once we've created your account for that primary point person, you will have the ability to create additional user accounts for users at your hospital. You don't have to, but you can. It might be nice to have an additional user who could serve as backup, or maybe you want a couple of people who know how to submit if someone's out of town. But that primary point of contact will be able to do this. We have done this in the past before. I should have mentioned that earlier. MHCC has collected HCAHPS data in the past, about 7 years ago, I think. So we're very familiar with this process now that we're restarting it. So it's not new to us. And in the past, we have had vendors submit on behalf of the hospitals. That is okay with us as long as the hospital and the vendor make those arrangements. And then the hospital can create the account for the vendor, and that's okay. And if you are a vendor and you're planning to submit for multiple hospitals, you don't need several different accounts. Just let us know, and we can go in and we can change your permissions to allow you to submit for those facilities. Okay, so I'm actually going to come back to this slide. I'm going to stop here and give you a demo. So bear with me while I change screens here. Okay. Can everybody see what looks like a website? Not my PowerPoint presentation.
Yes.
Okay, great, thank you. Okay, so this is the main homepage for the Maryland Quality Reporting consumer website that I mentioned prior. So if you are not familiar, or maybe it's been a while, the site looks quite different after our redesign. So just as an aside, if you want to find out information about your hospital, you can click on this hospital icon, and that'll take you to all kinds of good quality information. So I also mentioned health disparities. So we have a prominent initiative up here in this corner. If we click here, we have a brief description about MHCC's commitment to addressing the impact of health disparities. We've got a lot of great resources. We are building this up and we're very excited about this. And if you're interested in any of these resources, you can hover over and it gives you a nice little pop-up blurb of what you're about to click on. So this is an area where we potentially might be able to house our results once we start getting into the analysis of those detailed level, the HCAHPS data. So just letting you know, this is potentially a home in the future. Now, if you need to, or in terms of submission, this is our consumer facing side, but we also have what we call a provider side or private side. I kind of use them interchangeably. But to get there, you would click on this button in the top corner that says provider login. Okay, so now we call this the private side or the provider side because this is where we house more technical information. We don't need it to be as consumer friendly because we're dealing with professionals and people who understand the terminology and technical aspects. So we have a number of different settings that sort of mimic that homepage of the consumer side. So I'll just click on hospital to show you what this looks like. So this is an area where we can put important resources and documents and deadlines. So we don't have it ready quite yet, but there will be an option for HCAHPS data. So I've told you a couple times I'm going to get all this information out to you, but this is also where we will be posting really important documents and resources once it's ready, which it'll be soon. So just to give you an idea what it'll look like, I'll click on another topic, HAIs. And you can see that we just have some documents. We've got reporting schedules, analysis and reports, and regulations. So the HCAHPS section will look very similar to this. Oops, okay. And I just want to point out to you, you don't need a login for this. Anyone, as long as you can navigate here and you have the link, you can click on this and you can search around and find what you need. So now in terms of data submission, this is where you log in. It's the same website, but you would log in, you just enter your user ID and your password. So I'm actually already logged in. So this is what it will look like once you have an account and you log in. So you'll see a number of different icons. So I'll just go through each of these very briefly so you know what to expect. First, here we have documents. So those are going to be those same documents I just showed you. They won't be different, but we wanted to put them in multiple places. So if you're logged in and you forget what the timeline is or you need some kind of information, you can easily find it. We don't want you to have to go searching in multiple areas. So that second icon is profile. So this is just information about your personal profile. Anything in a red with a red asterisk is required. That I will enter that once I set up your account. After that, you can go enter in any information that you want to add for your account. It's not required, but you can if you'd like, and then you would just click save. I will come back to this reports button. I'm going to save that till the end. The security button, this is where if you would like to create a new account for someone else in your hospital, you can do so. So if you click on security and users, this will take you to an active list of users within your facility. So this is live. So I'm going to try to, this is a live list. So I'm just going to click here, create new user to avoid this information popping up. So if I hit that red button to create new user, and this is where that primary point person can create an account for a secondary contact person or backup or the person who will be submitting. So you would just enter in all the information with a red asterisk. That's all required. You can make up a user ID and then you'd hit create. So it's the same process. You would just let the user know what their username is, and then they'll also receive an automated confirmation link. So it's very straightforward. Okay, so now we have everyone set up with their accounts ready to submit, and you would just click on this submit option. Okay, so you'll come across a series of drop downs. So you'll choose HCAHPS, and then you would select the appropriate quarter in your facility. Okay, I'll come back to batch number. That'll be important in a minute, but right now we don't need to worry about it. So once you've selected these 3 items, then you can select your file, and it's just like attaching any other file to an email or what have you. And then you would click this red submit button. So it's very easy. We try to keep it very simple. Now, if you want to see your submissions, you would click on this reports button. Okay, and this is all fake data. So if you see your facility, don't worry, it's not real. We were just doing some testing. But this will give you a list of the information that you've submitted. So theoretically, there should be 4 submissions a year, 1 a quarter for your facility. And it just gives you some information. You can see the date and time, which quarter. Type will always say HCAHPS for this group. So just some general information. Occasionally, sometimes facilities might submit the wrong file or there was a change, and we might ask you to resubmit, or you may ask us if you can resubmit your data. So in that instance, you can resubmit your data the same way, but you would just need to find this batch number. So this is basically like an ID. So we'll just use this as an example, number 67. And then we'll go back to submit. And we'll choose our options. And then you would just enter in number 67 for your batch. So we know which file is being replaced, and then you would hit submit. Okay, so that was a very brief demonstration. I know it's hard to conceptualize something without seeing it, so I hope it was at least a little bit helpful to see what will be coming. So I will go ahead and just talk about these last 2 slides, and then we are happy to open it up for questions. So I just included some resources here, links to that provider side login for data submission. And then I also included a link to the private side where we plan to house these HCAHPS files. So that's coming soon, but once you click here, you should be able to get to that once that information is posted. And again, that'll just contain important files, setup instructions, technical specifications, and these are all open access. You don't need a login to access this information. So I know I went through everything quickly. I don't want anyone to be worried. We'll have all of this available to you. We'll have manuals, hard copies so that you can actually refer to it, especially the first time. And once you get used to it, it will be very easy. Okay, so I also included my email address here. You can feel free to contact us with any questions. We're always happy to help. If you need help with your login, or you want to add people to our contact list or take yourself off, all of that is okay. But we are always available and ready to help and assist however we can. Okay, so with that, let me just check the chat box to see if there were any questions. Yes, you will be able to get a copy of this presentation. I don't see any other questions, but if you have a question, you can feel free to unmute yourself.
Hi, Courtney. This is Julie Faulkner from Title Health. We work with NRC Picker. Will we be able to set up a process for them to submit the data to you via proxy?
Can you repeat that question? Is it a vendor?
Yes.
Yes. So yes, you can, as long as you make arrangements with your vendor, they can submit it to us through this. You can set up an account for them and they can submit it to us.
Okay, thank you.
Yep. And I have somehow lost the ability to see more than 3 people on my screen. So I can't see if anyone is waving their hand at me or anything if you have questions. So we can hang on the line for another couple of minutes.
Hi, Courtney. My name is Christy Bork. I work for MedStar Harbor Hospital. And like Julie, I'm thinking about using our vendor to submit this data. But you said that this is basically the same file that we submit to CMS. There's no other requirements needed.
Correct. Correct. So you can have your vendor submit on your behalf, or you could just get those files from your vendor and submit yourself directly.
Okay, great. Thank you so much.
Yep.
Hey, Courtney. This is Siobhan Edwards at Johns Hopkins. So I did mention this to our vendor. We used Press Ganey a couple of months ago, and they said they were actually aware of this initiative. So is there, are there any instructions that we can send along to the vendor to get them to get this set up, or should we just wait to get this presentation from you?
You can wait to get the presentation from me. Press Ganey is aware of the, sorry, I'm looking at some of the chat boxes. Press Ganey is aware. So I think they may have some representation on this call today too. So there will be communication throughout with them as well.
Thank you.
Mm-hmm. Okay, so Gail says submission to CMS are submission files to CMS are monthly, not quarterly. So we are asking for just quarterly. So at the end of the quarter. Okay, so Gail can't unmute. She says the files generated for CMS are based on discharge month, not quarter. So yes, so we want the discharge months, those 3 discharge months in that quarter. So we'll collect those at the end of the quarter. Correct. So there's 3 files per quarter, not 1. So we would like those files combined. So 3 files are, sorry, so 1 month, 1 file per month, and you combine them to 1 XML file for us. Okay, are there any other questions? I know this was short and sweet. Hopefully you'll get some time back to your day. And I'm happy to hang on the line a little longer, but if there are no more questions, you are free to go. And I will, of course, follow up with more information throughout the next couple of months. So we want this to be collaborative. I don't want anyone to feel like you weren't aware or you didn't have the appropriate resources. So you can expect plenty of information to come from me throughout the next couple of weeks and months. And we really appreciate everyone's effort to help us collect this data and really hope to use this to be able to spark some improvements in the coming years. So thank you, everyone.